Hi guys, I'm Dr. Garvey. Today I'm going to talk to you about advanced allergy therapeutics, but I wanted to introduce my business and myself to let you know what today's about. I'm going to be talking about the technology of advanced allergy therapeutics, functional medicine, and root cause analysis, and how I use this to help people who've been struggling for years with symptoms that just don't make sense, especially when your labs are coming up as normal. But I wanted to tell you because a lot of people don't know about the alternative treatments available through the technology of advanced allergy therapeutics that I've been using for almost 20 years now. It changed my life literally in a day. And then over the next year of the tons of things that I had reactions with, most people it's a handful, but for me it was over 100 that I developed hypersensitivities to. Even my own biological substances I was reacting to. Now, that's not the case for everyone. Most of the time, you have a dog sensitivity or something like that. We can easily address that. It's so amazing. And that's what we're going to talk about today. Always thinking about not being a victim, being your own health advocate, and actually, being able to expand from a restriction, right? If we're always thinking about that, expansion rather than restriction, right? Not more food elimination, not more restriction, but to enjoy this life and have real freedom around environments and foods, and to be able to do the things and have the functions properly in our body to enjoy the things in life, right? Life's short. I'm here to help shed light on anything that I can help shed light on. Okay, so today we're going to be talking about allergies and sensitivities. I utilize, again, the advanced allergy therapeutics technology. Not just with advanced allergy therapeutics can I address those different substances and stimuli that are associated with the symptoms of allergies, sensitivities, histamine intolerances, mast cell activation, respiratory issues, digestive issues, right? Dermatological issues, mood changes, anxiety, depression, but most importantly, like really seeing why these are connected. So if you've tried everything and you still don't feel like yourself, stick around because you're going to find some really great information here. And of course, I offer a free 10-15 minute consult for anyone all the time because I just want to help people figure out, like, why is my body reacting so strongly to something that seems harmless, right? That's the question at the heart of almost everything I do, especially the advanced allergy therapeutics, right? Most people have been told that just to avoid a food or take a medication or live with their symptoms, but what if the issue really isn't actually the substance itself? What if it's how the nervous system and the immune system are interpreting that substance? And with AAT, that's what we can actually see, like, hey, why is this, dust mite or this dust or a cat hair making me have such a full body reaction? Sometimes it's like fatigue. Again, sometimes it's just respiratory or digestive or dermatological. But why, right? So with the AAT, the stimulus response connection is so amazing that you literally in minutes can change that perception. But with the functional medicine approach, we see why. So if it's just a stimulus response thing, most of the time, again, allergies and sensitivities occur because the body mistakenly perceives a harmless substance and deems it as harmful and then reacts inappropriately. And here's where AAT just shines because, again, here's the stimulus, here's the response. We literally change that in minutes. So I have people fly in, especially during the holiday season, where they want to get a dog or get a pet of some sort. And we're able to literally, in most instances, one treatment. So whatever symptoms XYZ that you had for that specific pet animal, even horses, all farm animals, everything. We literally have every animal in this entire database, that we're able to calm the associated symptoms that have been provoked by that specific substance. So certain symptoms, again, it doesn't matter which organ systems are involved, right? Because this isn't always an immune regulation issue. Immune issues are really IgE with hypersensitivities, and then we're really sensitivities, allergies symptoms, but we're really looking at root cause when we're addressing those. So why is there immune dysregulation? There's a path to go down for that. But with AAT, and that's the functional medicine root cause path, but with AAT, it's literally calming the body to that harmless substance, because we're able to do that because there's not a contraindication to calm it down when it's having a hyper reaction to a substance. So if you're suffering from like a digestive, skin, respiratory symptom, it really truly might just be a sensitivity. Most people, and again, I'm almost 100% referral, they see, if they heard about me, they come in, they check for that specific substance or stimulus they wanted to address, and then it's over. And they don't have to go down the functional medicine path because there isn't actual immune dysregulation. There's just a hyperreaction to a substance. So if you're suffering from skin, digestive, respiratory symptoms, truly, you're not alone. This was me my whole life. You literally just may be having that symptom. Okay, so allergies in the 21st century. In the last 30 years, allergies and sensitivities have increased substantially worldwide, more than doubling in some countries, right? We're seeing an explosion of allergies worldwide. They're just on the rise. There's different reasons, but more than 100 million Americans alone suffer from allergies each year. And that's from the Asthma and Allergy Foundation of America. So percentage of adults who have allergies in the U.S., 30%. Percentage of children, 40%. So I'm very honored to be given the award of New Jersey's favorite kids doctor for this reason of the advanced allergy therapeutics technology and my root cause approach, because everything that I do is safe, highly effective, and truly doesn't cause harm. So it's an amazing way, and rather than just using medication always has its purpose and its place, but for the treatment of allergies and sensitivities, avoidance and or steroid medications really is just not an option for me and for millions of people that can't avoid these substances and don't want to live such a restricted life. But allergies are the sixth leading cause of chronic illness, and it has in the U.S. and have an annual cost of over $18 billion. But are you tired of needlessly suffering from your allergies and sensitivity symptoms? We can help. This is literally the best thing for you. Are you tired of having to avoid your favorite foods? I was so annoyed at my own restrictions that I couldn't even go out to dinner and actually enjoy myself because I was so worried about what was going to be on my plate, even though I have to give those explicit instructions, be the person who gives the exact detail, ask every question about the food, right? But and then not being able to go outdoors. I mean, what's happening? It's like we felt that restriction for COVID. People don't want to feel that again. It was so restrictive. So when you feel that, know that freedom, who wants to go back into restrictions, right? Or not being able to be around things you love, like an animal or an environment, or, go for a walk in the woods or be on a sandy beach. The AAT literally can change that in one session for that specific stimulus. So food and chemical environmental sensitivities, this one lady had plagued them for years. She truly didn't understand the systemic effects that they were having on her overall health until she started the AAT therapy. The AAT therapy reduced the stress that my body was under all the time from these allergies. But specifically, there were a host of things that she can now eat without pain. I can have and enjoy my garden, she said, without causing serious side effects, and I can travel without worry. I recommend this treatment to anyone who will listen. So thanks, Joan. But here are just a few of the most common items that contribute to allergy and sensitivity symptoms. Of course, like we said, all the animals, especially the insects. I've had the gnats, kids literally in the hospital ER from gnat bites. I didn't even know gnats could bite. But dairy, of course, one of the big ones. Grains, eggs, shellfish. These are the big top worldwide issues, right? Sugar, huge. chocolate, right? These are like, how wonderful are these? We don't want to, of course, we're not eating sugar by tons, but we don't want to have full restrictions of these, especially the associated symptoms, including behavioral issues, especially in kids, right? Wine, beer, to be able to socially enjoy these things. I enjoy these. I could never have these before, but now I'm able to have these. Coffee, oh my goodness, are you kidding me? Teas, these types of things. Tomatoes, corn, right? Yeah, tomatoes are high in histamine, but I don't want to have an allergic reaction because I had tomato or corn or fruit or berries. Of course, all the cosmetics and lotions and soaps and shampoos. And I mean, just the average woman, they said, uses Environmental Working Group, which I highly recommend, right? It says that an average woman uses 18 to 20 products a day. That's a lot. So utilizing the Environmental Working Group to find out which are, endocrine disruptors, because this stuff can accumulate like forever chemicals, forever plastics in our body. Yes, we want to use the most organic and holistic stuff that we possibly can that causes no harm, doesn't accumulate in the tissue, but we shouldn't have an allergic reaction to things as well. But of course, dust and dust mites, isn't that so scary? I hate the look of a dust mite. Of course, mold and mildew. Yes, mold is there and mildew is there. I utilize functional medicine to see if it's actually in our body and producing toxins, but mold in general is usually an allergy. When it becomes a problem is when we've been exposed to it and it produces toxins in our body. And these are some of the different root causes for why we may have actual immune dysregulation. Again, the advanced allergy therapeutic isn't dealing with true IgE immune dysregulations. It's hypersensitivities to these substances that can appear just as though it were a true allergy. Chemicals and petrol, paints and varnishes, the things in our households that we might not realize. Even in the schools, I've had many kids reacting to going into the school after the summer and they painted and they, used new things, and those VOCs are there and other substances, and we're having hyper reactions to them. Of course it's contributing to the ability to concentrate. You're in inflammation, you're having an allergic reaction or a hypersensitivity to something, and these chemicals are being produced in your body. That's real. But different jewelries, I've had many people, got a new ring, 25th anniversary, and they're reacting. It doesn't mean, I've had a lady, does this mean something? No, it doesn't mean anything. It just means you have a hypersensitivity to that metal, and we can easily address that so you can wear your new beautiful ring. Different fabrics, of course, wool is known as itchy, but every fabric. I even had a woman who had an allergy to every fabric, developed it during menopause, except for silk, of course. She said the most expensive. Paper and ink, even the smell of newspaper ink, and even like copier, those types of things used to bother me years ago, before I had these treatments, but I never realized it, right? So markers, different types of things, even the smell of money. Nobody wants that allergy or sensitivity. But glues, adhesives, of course, we get a Band-Aid, you might get a rash, but other things, like I had many people coming in for the eyelashes, the glues, the different things that we're using for their wigs and toupees and different things like that as well. Of course, occupational, right? You're working with wood all the time as a carpenter. My wonderful brother is an amazing woodworker. Being around flowers, right? Being around different foods and smells as a chef. Of course, all the different things that you're being exposed to as a dental assistant or a dentist. But things we don't think about that you can actually calm the body's hyperreaction to are things like barometric pressure changes, motion sickness, those types of things where, these get going from hot to cold. I've treated so many people, that have a skin reaction, let alone full hives I've seen from just going out for recess as a teacher and then coming in and having huge welts all over their bodies, right? And then the kids get frightened. And sunlight, just having a UV sensitivity, and it actually can break it down to the different types of UV light that we may be reacting to. So, and it could show up again in many different ways in different organ systems. But did you know that people can actually develop sensitivities to actual components within a substance? So with traditional, even functional medicine testing of blood, when we're checking for blood testing for reactions to different foods, they're always checking a protein. It never checks a phenolic, a mineral, a latex, the vitamins, different components, the amines, salicylates, the phytosterols that are actual substituents, little components of that broad category. So only proteins are tested. So there's where, right, everything is good and bad, but there's the limitation of a blood test. And some of these tests are extremely valuable, but nothing has what Advanced Allergy Therapeutics has that I have found ever yet to this date. But all of these things really truly can be successfully addressed with the Advanced Allergy Therapeutics. So this is where I have an advantage, and practitioners with AAT, no matter what their practitioner of, a chiropractor, an acupuncturist, a medical doctor, a nurse, an osteopathic doctor, when you have the Advanced Allergy Therapeutics technology to be able to be utilized if needed for a patient, these itis and different symptoms associated with specific stimuli are literally not longer an issue. So it's just so amazing that we can see that result so quickly in so many people. It's just, there's nothing that I've ever had that is that quick, and no supplement or medication is needed. So it's just amazing. And what I've seen over the last 30 years in practice is that, these symptoms, they seem so random, right? Because we're going to all these different doctors, but they're so connected. Even when they look completely unrelated, right? The body doesn't compartmentalize the way that we do in medicine and different approaches with different treatments from different specialists, right? But if you're dealing with like a food reaction, environmental triggers, chemical sensitivities, or symptoms that come and go unpredictably, I just want you to know, and your labs are normal, right? Your body's not broken. Your body's literally reacting inappropriately, in most cases, to a system that has become stressed and overloaded or mistrained. And that's very different than just me, looking for something that's defective, right? So is there something that's there? Is there a pathogen that's there that we're unaware of? Is there a pathway that's defective? With the Advanced Allergy Therapeutics, it's literally medication-free therapy that's non-invasive, that helps the body relearn how to respond appropriately to substances or stimuli that it is mistakenly labeled as dangerous, right? So, it combines the principles of many different approaches of like neurology, acupuncture, Chinese medicine, chiropractic, nervous system regulation. But with this, we're not suppressing symptoms with a medication or a supplement, just dealing with a symptom relief. We're actually correcting the errors in perception within the nervous system. And nothing that I've ever found is able to do that. So when we're looking at the AAT, it's been since 1995 that we've been specializing in the treatment of symptoms and allergies and sensitivities. Before that, it was in New Zealand and Australia, but in the States, it has been tremendous, and I'm so happy and fortunate that I found it. But it's successfully treated tens of thousands of patients over the years, all whom were simply reacting inappropriately. That's the key, to something that's benign or harmless, right? And that distinction is really important, because we can calm the body down to something harmless. We don't want to calm it down to a true pathogen, right? We have to address that true pathogen. And that's what I do with my functional medicine approach. We actually find that trigger, that thing that should not be there, and remove it, right? And I work with you to determine, best approaches to do that. But Advanced Allergy Therapeutic, again, is a clinically proven treatment that merges 21st century science with 3,000-year-old acupuncture principles, traditional acupuncture, modern chiropractic principles, that is highly effective in treating the many, many, many symptoms associated with allergies and sensitivities. It was developed through over 28 years of collaborative research by healthcare professionals in the field of acupuncture, naturopathy, and chiropractic. And we get updates to this technology often yearly. With AAT does not rely on any medication, right, or herbal remedies or avoidance or injections or supplements. So that's what makes it uniquely its own, outside of my functional medicine or traditional medicine approach. So it's wonderful. So there's not a compliance program. You don't have to comply to a treatment program. You literally just address it and you move on. It's completely non-invasive and totally painless. It's available to people of all ages, including infants. My youngest patient was a 2-week-old child, and she was actually reacting. I had no idea, but it was colic, and the mom had no idea, and she's a nutritionist, but she was actually reacting to the the progesterone. The mother was taking placenta pills due to her first child. She had severe postpartum and was advised, she's a holistic nutritionist, was advised to take the placenta pills. At that point, I didn't really know too much about those things, and the technology allowed us to identify that stressor. And within, I mean, a few minutes, I mean 2 to 3, the baby stopped crying. And it ended up that myself, the mother, and the 2-year-old, her other sister, were all crying because now the baby stopped crying, and we were so happy and filled with joy. They were tears of joy. But it's truly, it's absolutely amazing, and I'm astonished every day, and I'm so happy that I'm able to have access to this technology to help people, because I truly prayed for this as a child. I prayed to God. I'm a Christian. I prayed to God that please help me fix myself so that I can help others. And that's why I know I'm doing what I'm supposed to be doing in this world. And it's just hard to get the message out when you're trained to be a doctor, right? That's what we are. And then here you have to like market and do all the business information. So I haven't been good at that. So I'm getting out of my shell and I'm doing it now. But I'm naturally an introvert because of all the reactions that I've had over the years, right? But I have to. I feel like it's truly my life's mission to, of course, address everyone, but especially the children, so that we can actually prevent decades of inflammation and unnecessary reactions that I personally dealt with. So that's my like sole goal of what I want to do for people. So that's why literally I'm like, just please give me a call. It's free. I will talk to you for 10 to 15 minutes. I usually end up staying a lot longer, but just to like put a different set of eyes on something so that we can see if that's it. So like literally diving deeper into allergies and sensitivities, right? So we can see, is it that, and can it be addressed for AAT, or is it something that actually needs to be addressed with a root cause approach? And that's what we do. And I also do neurovagal dysregulation. So because I had all of these things, and each one was extremely significant to me personally to give me resolution of all of the different things that I had to deal with, okay? Because once you realize, of course, yes, I had all these allergies and sensitivities, but I also had strep infections. I had strep multiple times as a child, and we just used antibiotics over and over and over again. Back then, everything was overprescribed, right? And these antibiotics are critical for survival, of course, when you have a pathogen and you have to kill it. But, it was overprescribed back in the 70s and 80s, and it can destroy your gut and kill your good guys. And then your root cause is sometimes, immune deficiency, and you don't have what we need to sustain proper function in the body. So there's where there's true immune dysregulation, and it can absolutely be addressed, but that's not addressed with AAT. It's not an immune system issue. So let's dive deeper and see if AAT can help you. The word allergy has become generic form used by the public to describe allergies and sensitivities and intolerances, but they are extremely different. They truly are. But a true allergy is an immune response to a specific substance called an allergen that's usually harmless to most. But the immune system is overreacting to that allergen, producing antibodies that trigger the release of histamine and other chemicals in the body. This can cause a wide range of symptoms such as itching, hives, swelling, wheezing, and anaphylaxis in severe cases. And again, only IgE allergies can become anaphylaxis. But even with blood labs, we can see if there's an IgA or an IgG reaction as well. And it just shows us different immune involvement. That does not get checked with AAT. AAT utilizes muscle response testing, not blood testing. But again, we have options, and that's what I help you figure out in our free clarity calls. A sensitivity, though, is a non-immune reaction to a substance that can cause symptoms like allergies, but is not caused by an immune system response. Sensitivities are much more common, as fewer than 5% of the population actually have a true allergy. And I never understood that. That's why when I was going to the different allergists, and they're like, you don't have allergies. You're just stressed, right? So it wasn't the case. I really did have so many sensitivities. I had 113 sensitivities. But where a food intolerance, right, is typically due to a lack of specific enzymes that cannot be treated with AAT. That's when we get into specific for food, but there's also histamine intolerance as well. But for food, the examples are like lactose intolerance, so that you have the inability, because you don't make an enzyme called lactase to break down lactose. So AAT is not going to address that, right? You actually have to supply a digestive enzyme of lactase to break down lactose. So that's different. So the AAT is ineffective against those types of intolerances. But when allergic symptoms are present, the body is reacting inappropriately to a harmless substance, food, or stimuli. And that's just crucial to understand that. But how does it happen, right? The human body is constantly, that's their ones and zeros, constantly interpreting whether a substance outside or inside the body is acceptable or a threat. Just like you're walking down the street and you hear, you see, you smell, something evokes a sense. And is that something that I'm going to approach, or is that something I want to retract from? So that's that part of that memory of remembering that stimulus response. So a poison is registered as dangerous, right? Information to the system. And vitamin C is like registered as beneficial. So it's safe. It's something I want to go to. But there, with allergies and sensitivity, there's an error. So reactions occur when there's a mechanism of interpretation becomes impaired, and the cause is the same for all inappropriate reaction. There is an error in perception. If the error in perception can be corrected, the related symptoms can be resolved. The body can accept that substance as harmful and no longer reactive. So as far as perceptions, again, I utilize Psych K. And when we have a belief or we have a perception about a circumstance or a belief that's not really a truth, it's just a belief, because different beliefs come from different reasons. But if those thoughts are being repeated over and over again, right, you have a perception of a situation or a perception of yourself and a belief about yourself. That's often limiting, and we can rewrite those limiting beliefs to beliefs that support you. And that's what I do in the Psych K work. Again, these are the things that I had to deal with myself, and now I do these. Now, not everyone has this, right? But a lot of people do, and it can not allow us to have the best life that we could possibly have. And we're here for a short time. Let's make it the best, right? Decrease and eliminate those things that are actually causing disruption in our body. Change perceptions of different stimuli in our environment and different foods and those types of things, and change beliefs so that they're supporting us and not hurting us, right? And not limiting us. But negative conditioning in regards to advanced allergy therapeutics is exposure to allergens at certain times when the body's defenses are lowered or weakened, such as a viral infection like COVID, or pregnancy or some type of trauma, right? That seems to contribute to the development of allergies. And that's the National Institutes of Allergies and Infectious Disease said that. So the more stressed, right, even mental stress, right, the body's systems are, the more likely they are to become overreactive to a substance and mistakenly associate that substance as being harmful, and even though it isn't. And this really truly explained like most of my life, right? So we all have different traumas and different degrees of traumas, right? I had an alcoholic father, and back then it was physical, reprimanding and punishment. But, the body systems react, right? And then there's anticipation, then the beliefs become, my driving force of what you believe about yourself, and if you deserve something, or if you're good or bad, and different situations, which then can also lead to negative behaviors, and of course addictions, and things that are sabotaging what we actually want for our lives, right? Because we may have these beliefs. The same is true for these misperceptions. You're restricting yourself, you're staying indoors during the spring and summer, right, when you should be outside. We're restricting foods, we're restricting different environments for ourselves, which literally go to our personality, right? So often we're like, I don't even like myself. There was a point where I couldn't stand myself because I couldn't stand all the sensitivities that I had. I annoyed myself, right? I don't want anyone to ever feel that way, but I did, and it's the truth. And I was just wanted change so badly. It's one of the reasons why I went into chiropractic in the first place and was looking for a solution my whole life to the different symptoms that I had. And back then it was just going from one specialist to another specialist to another specialist. And even, I had a nurse tell my mom one time that I was a hypochondriac, so it's like, and that became a label for me, and it became a belief. And then when other doctors were said, we all know this is in your head. I had a cardiologist in my 20s, and they're like, you shouldn't be in a cardiologist's office. You're 20-something years old. Well, what I know now is I had so many sensitivities, right? But I also had sympathetic dysregulation, right? So even getting chiropractic care, even doing Chinese herbs, doing, acupuncture for stress, those types of things. And of course they helped me, but it didn't fix me, right? So it was temporary. Treatments are temporary. But with AAT, it's literally the only thing I ever found that was literally, let me calm you to the stimulus, let me address this with the advanced allergy therapeutic technology, and it is done. It's done. I've never found anything that's like this. That's why I am like an ambassador for AAT, truly, but it's because of my own experience. And this is why I want to be able to share this information with people, right? So COVID just dysregulated everyone, right? We were in full restriction. People never felt that way before. It affected everyone, no matter what your economic status was, where you were from, who you were restricted. And that fight or flight activation, right? Everybody was so scared of every cough, of everything, really created a lot of hypersensitivities in a lot of people. So, the explosion of hypersensitivities after COVID is, in my opinion, at a rate that I've never, ever seen ever in all of the years that I've been a doctor. Okay, but the conditioning effect, the ability to affect physiology with an external stimulus, was literally the Pavlov experience, right? So in 1903, that they showed that a dog's physiology could be conditioned by associating food with the ringing of a bell, right? So that they would drool and have that response to sound rather than just to food. But the dog's salivary glands would be activated by the stimulus even though there was no food present, simply by creating an association with that food. Excuse me. During treatment, gentle pressure is used with AAT on these points that correspond with the organ system involved in a reaction, and truly the sympathetic nervous system, right? So this is what I work with. I know this in and out. We did 5 years of cadaver lab. These are real points. These are real things. The sympathetic nervous system exists. That is what we're directly working with as a chiropractor and with the AAT technology. So when the stimulation is applied, a subtle representation of the offending substance is introduced to the surface of the skin, and that's the AAT proprietary technology. That's what they allow us to do, to create an association, right? So that stimulation reduces the hyperactivity of the affected organ systems and reduces that sympathetic fight or flight nerve activity. So the body associates the enhanced state with that second stimulus. So simultaneously, you're doing them both. That signal with the sympathetic nerve activity and the hyperactivity that was the corresponding thing, so that together that conditions the body to respond more appropriately, less fight or flight, and creates a new association. So that, stressor, oh, this is deemed as something dangerous or harmful, now has a new interpretation. Literally like that. It's astonishes me, I promise you, every single solitary day. But a sensitivity or inappropriate reaction may cause symptoms from any organ system. So that's why it could literally be any itis. So it's not, oh, it's just dermatological, it's just digestive, it's just respiratory. It's anything. So any substance can cause any form of really any symptom. The symptoms of a reaction depend on which organ system is affected in the body. So literally, let's just use dairy as an example, right? So excuse me, stomach, right? Some people get reflux, some people get heartburn, cramping, bloating, nausea, especially little babies, right? We're taking these little kids, even my niece, to the gastro, and she was 6 months old. But the large intestines, right? Irritable bowel syndrome, bloating, abdominal and intestinal pain, constipation, diarrhea. But the point is, it's like it varies depending on the organ systems affected. Like those symptoms vary, but it's still the same substance that's creating those different organ system reactions. So same thing, dairy can have hay fever, wheezing, asthma, skin conditions, rashes, itchy, watery eyes. And who's thinking that, right? But skin, this was part of my issue, was dairy, for my eczema and my different dermatitis, rosacea, and psoriasis that I was diagnosed with. But skin rashes, hives, blisters, atopic dermatitis, just from sometimes dairy, right? But treatment specificity is the key. So like while most allergy therapies address the primary substances, the majority of cases are actually those components within the substance. And again, the blood tests are only checking proteins. So the key to the success of AAT is the extensive research on the substances or offending items causing those reactions. That really is the key. So there's over 85,000 different stimuli in here. Any aspect of any substance may be targeted as a threat. That exact micro substance must be identified for 100% resolution of those associated symptoms. That's why AAT is literally, there's nothing else like it. Treatment specificity, there are thousands and thousands of molecules and substances that may cause hypersensitivities. Many of the actual substances are impossible to obtain as physical samples, so a signaling system was needed, and that's why they created it. So years ago, you'd hold a vial, you'd test dairy, you'd see if it, there'd be a little dairy in a vial, and you'd muscle test that. I did that for years with homeopathic solutions. That was the other thing I did. I worked for the California College of Natural Medicine. The late Dr. Teresa Dale's absolute genius, absolutely wonderful with her remedies, a homeopathic. She has them for allergies. But again, you have to keep taking it. So again, same thing for supplements, homeopathic remedies, herbs, right? Medications. Here, you don't need anything with the AAT. You literally just address it and you move on. That's why it's so wonderfully aligned for anyone. Okay. A proprietary signal system was developed by AAT to replace the actual substances needed for the treatment. The digital signals in the AAT technology. That's the database. The computer stores that database, but they are utilized to represent a substance. So we're never evoking an inflammatory response because we're not using a actual substance. We're using the digital representations, the digital signals that are completely non-invasive and actually have no therapeutic effect on the body, right? So it allows us to not have to use an actual substance, right? And then it allows us to have a much broader range of substances that can be addressed, as the many items needed for treatment are impossible, truly impossible to obtain, right? Barometric pressure. You can't put barometric pressure in a tube, right? But it's the acupressure, the stimulation of that sympathetic nervous system along the spine that is responsible for reducing the stress caused by that substance. And that's how it modifies the inappropriate reaction while you're simultaneously being exposed to a substance in that AAT database. So now it's over 85, but there was over 65,000 previously, but just this a month or two ago, we got another update again, over 20,000 different substances again, all the long COVID, everything else, all these different amazing. I love it. I get so excited by it. I hope you can feel my passion about it. It's because I've lived it and I get to experience. So it gets literally the most exciting part of my day is work. And I just have such joy in knowing I'm doing this, and the AT allows me to do that. So I'm forever grateful. But different samples of or like species, the individual substances, the species, the components under those, the components of the components. It's like an outline form, and it just gets broken down, A, B, C, D, and then one subunit one, all the different times, all the way to even the aroma molecule, different molecules of those substances. So even like the smell of a cat, you're not even touching a cat, right? And you can calm the body to the smell. Like for me, I would walk into an area and I would smell mildew or mold immediately and get a headache, right? So I can still smell those things because it's smell, but I don't have the reaction to it any longer. So most people are not even aware that there are multiple components within an item that can contribute to a reaction, especially even for me and most people. They're like, well, it's a protein. It's a protein. You can react to other things other than protein. Just because a blood test is only showing protein doesn't mean you can't react to something other than the protein. And that's why so many people are like, but I do react. But they said my blood lab was normal. My allergy test was normal. This is where AAT is like literally for you. But here are just a few examples of components found in everyday items that are commonly addressed during an AAT session. Like a lot of the times people just get casein checked and they're like, oh, it's just casein, right? But look how many other things, or they're looking at lactose, right? But there's so many other things. Whey is huge. And so many people don't realize, like, your protein that you're putting in your smoothie, or you're out at a fruit bar and they're like, would you like a protein boost? That's whey. And you're like, oh my goodness, my belly hurts, or this or that. And you may have a dairy sensitivity and you're thinking it's the fruit. Okay. So, and all the bulk protein, the whey protein, right? These young people and adults are taking, to bulk up. Sometimes that's part of it. And a lot of people don't make the connection that whey is a component of milk. I had the reaction as well. A lot of the detox programs too, it's whey, because whey has so many wonderful benefits, right? It helps the liver for detoxification processes. But if you're having a sensitivity to it, that's not the one that you should be utilizing until we actually can address it with AAT. Red wine. I lived right outside of Napa Valley. I literally was almost sent to the ER. I was going to call the ambulance because I didn't realize red wine, I had an allergy to it, as well as it's extremely high in histamine. And it actually turns off your ability to break down histamine. It turns off an enzyme. So it's like a triple whammy with the sulfites, salicylates, yeasts in it, as well as all the glutamates. For people that have sensitivities and know about those things, you have multifactorial issues with red wine. And of course, I wanted to enjoy it. We rented a limo, we did all the winery tours, and it was literally like one of the worst days of my life. I thought I was going to die. But now I can enjoy red wine. It's wonderful. Cats, again, the more we can save animals is wonderful, and actually release oxytocin and feel love, even when, unconditional love, is just such a wonderful thing. But just even the fel D1 protein, a singular protein, is the only allergen tested in conventional medical allergy tests. Look how many other things there are, right? So it's just so frustrating when they're like, you're not having an allergy to cat. And you're like, yes, I am, right? And sometimes the kids are sitting next to somebody in class. I've seen this so many times, and they can't even concentrate, and they're itchy, or their legs are shaking, and they're like, oh, this kid's got ADD. No, you could actually be having inflammation because the kid next to you has got cat hair on them or dander, and you might not even see it, but you're reacting because you're sitting there and you're breathing it in, right? So who's going to figure that out? It's hard to figure these things out. We can't think of everything, but that's why getting an AAT assessment is just so wonderful to see if this is actually something that potentially is contributing to your symptoms, right? So the AAT just possesses an extensive database of substances, stuff that doctors aren't even going to think about. Like, again, I didn't know about the progesterone, for a placenta pill, and it's not even in my conscious brain to muscle test. And I use muscle testing for tons of things, but if I don't think about it, I'm not going to muscle test it. But here we muscle test it, and we see if that's a contributing factor. But with so many substances and components, how do we figure out which substances are causing stress on the body, right? We use that stress assessment. And that's truly, really what it is. It's looking at, it's not allergy testing. It's going, what's creating a stress in your body? Now, I use allergy testing in a functional medicine sense if it's needed, especially if we're having really bad reactions. We want to make sure that there's not a true IgE allergy, and we can check this. I mean, of course, regular blood testing, but now I'm able to even offer blood spot testing for the little kids. So, and some of these are covered by insurance. So it's absolutely wonderful that we have these available to us now. And this was not available before COVID. So this is newer, and it's amazing. And I literally can be virtual with people. Don't even have to see you for those types of functional medicine visits, and literally send you directly to the lab. Some are at home again, and everything's handled through these lab dispensaries, and you're paying directly the payment to the labs. I'm just the person who says, we should definitely check this, right? And then you can use your HSA card if it's not covered through insurance. But then we go over these things and we put it in the bigger picture of what's going on with you, if there is something that's been dysregulating you this whole time, and we put those pieces together. And that's what I do with my full holistic approach. And I just love being able to offer all these things for everyone, because again, not everyone needs a functional medicine approach, and it's just AAT, but these things are available when it's not a hypersensitivity, right? But instead of AAT, treatment uses a dedicated and specialized stress assessment method that allows the practitioner to determine whether any organ system in the body is responding defensively or inappropriately to a specific stimuli or substance. And the stress test is a method of manual biofeedback technique that tests the body's perception of a stress caused by a substance or stimuli. And again, I have the fortune of being able to have done muscle testing for decades before I even found the AAT. So I've been using it for, again, beliefs and, pattern thoughts that can cause stress responses, as well as testing for seeing vertebra misalignment and different reflexes in the body for nutrients, and supplement muscle testing to see what may be needed. But with the AAT, it's just was so wonderful to already have that ability to do that, and now have an entire database that there are tests that aren't available, and things that can't be tested. Now we can address all those other things and stimuli and environmental things. The things that are in here are just absolutely amazing that so often can come up Um, but AAT has shown that a vast number of symptoms and conditions are actually caused by inappropriate or negative reaction to a harmless stimuli. And it's true. It's when you're able to come in person. I often start here, but again, it's case by case. But sometimes, like I say, if we don't need to go down a rabbit hole, there's no reason to go down a rabbit hole. Again, the most expensive test is the test you didn't need. So with AAT, if it is a hypersensitivity, there's no foul, nothing's bad, right? So you can see what you're having a hyperreaction to and address that. And if that was it, it's over, right? So you didn't have to do anything else. Again, so many different things where we're going to all these specialists. It was me. I literally went to everyone. I did the Deepak Chopra Center. I spent $5,000 to, I love Deepak Chopra, but again, didn't shine light on what was really at the root of my issues. Ayurvedic, every Ayurvedic one a treatment I ever had, I absolutely loved. All kinds of therapies, all kinds of treatments that I did over the years, and every one is amazing on its own, but it didn't address my hyper reactions. And again, I was over 100, so I was definitely the odd man out, but it was a lifelong nervous system dysregulation that predisposed me to misinterpret my environment. And that's why I addressed neurovagal tone virtually and in my office to see if that's actually, it's called brain dominance or hemisphericity. If one side's working a little bit more than the other, that guy's just running the show. It's like you went to the gym and just worked out that one bicep. It doesn't mean the other one's weak. It's just that this is my go-to side. And that's what was happening for me. So I was misinterpreting more and more and more things because my brain was in a stress state. It was just overloaded and more hypertoned on one side than the other. So again, neurovagal tone, psych K, functional medicine root cause, of course, advanced labs. We can order almost any test on the planet. But my gold is the AAT because there's nothing else that I've ever found like it. But again, chronic congestion, sinusitis, IBS, seasonal allergies, environmental allergies, acid reflux, heartburn, respiratory symptoms, headaches, migraines, any type of skin condition at all, literally any type of digestive issue at all, food sensitivities, allergies, chemical sensitivities, it's just so vast, the amount of things that can be triggered even by the same substance. One substance can actually do most of those things. It's incredible. You'd never think, how could this create this, but it can. Yeah, so it's like trigger XYZ symptom, and it could be anything, any trigger, any XYZ symptom. But allergies can contribute to persistent inflammation, and that's the itis, right, of anything, the sinuses, the mucus linings, really increasing the susceptibility of sinus issues and chronic sinusitis, right? And because I know a lot of the immune dysregulation when we actually test, there's markers called secretory IgA that can show us like mucosal issues, right? So and there's where we have a hyper or a hypoimmune response, but we always look what's causing that, right? But if we're constantly getting triggered, that's part of the cause, right? And then we look internally as well to see what's actually maybe a chronic 24/7 stressor versus, hey, it's just dust, hey, it's just pollen when I'm engaging with a stimulus. Is there something that's chronically all the time addressing those? And that's the root cause. But as far as allergies and sensitivities go, that's where we're getting those common sinus triggers like dust, pets, environmental allergens, fragrances, chemicals, like, and molds, like a mold allergy versus like mold toxicity, where I actually have toxins being produced in my body, right? So that's not the same. But 28.9% of adults are diagnosed with sinusitis. And there are over 2.7 million visits to doctor's offices a year just for sinusitis. Okay, but IBS, this is like, hits hard for me, and it's just, the gut is the second mind. So It absolutely affects mood and the way the brain and your ADD, all these spectrum issues. Of course, there's other components to it, but it absolutely plays a role in cognitive issues and mood and emotion regulation. But hidden food allergies and sensitivities play a significant role in the development and exacerbation of IBS. Common triggers: dairy, wheat, sugar, yeast, salicylates, corn, soy. I mean, that's just a handful of them. IBS affects between 25 and 45 million people just in the US. And about 2 in 3 IBS sufferers are female, right? So often they say, oh, it's stress, oh, it's emotion. And that's why that's happening. It's frustrating, I know. But I believe people because I've been through it when I haven't been believed and been dismissed. So I listen, and that's why I try to literally just make myself available for people for a free 10-minute consult to have a new set of ears and like for labs and a new set of eyes on something to go, hey, did you think about this? Hey, did you ever check this? This, can be seen. And because I have so many, I've seen tens of thousands of people. So I learn every day from my patients, right? So this is like experiences, right? You learn from experiences and you're like, oh my goodness, yes, I had a patient just like this. And especially those ones that you can't believe, like, oh my gosh, how was it that? I had a lady who was just a baker during the holidays from Thanksgiving to through January, and was reactive to the spices and essential oils that she used in her cookies. But her manifestation was full psoriasis. Now, how's the psoriasis? And she said she didn't even eat the cookies. She's gluten free. So she's having full psoriasis on her scalp, on her neck, on different places that she's not touching her with the gluten on her hand, but she was still reacting. So it was on a molecular level, and she would have these full psoriasis flares for years, every time during the season, and she just thought it was the winter months, right? So it sheds light on things that we may not understand. But one patient said that they have had digestive problems for several years. They went on a gluten-free diet and did well, but avoiding foods is pretty hard. And if you have an active lifestyle, right, you want to go out places. You don't want to always be restricted. But there were so many foods they missed eating. After going through the procedures of AAT, they can now eat whatever they want without fear of a reaction, and has made my life so much simpler, less stressful, and better tasting. And I mean, that just hits my heart because that was me. I literally just constant scanning of food, ingredients, and lists. It's just takes up so much thought and mind power that when you don't do that anymore, you're like, oh, this is what it's like to just be, right? Just be present and actually enjoy your life. But acid reflux can occur anytime, although it's frequently experienced following a meal. Common food sensitivities that contribute to heartburn are spicy foods, onion, citrus, tomato products, fatty or fried foods, alcohol, or carbonated beverages. But 20% of the population suffer with acid reflux. It is associated with other things as well, but allergies have the potential to trigger or exacerbate reflux issues. But one of the things is H. pylori, and H. pylori dysregulates so many things if that is an actual true pathogen in the body, and that's what we test for as well. Especially if, the symptoms weren't relieved with AAT, you almost know immediately that there is a root cause. And of course you can do endoscopic exams. We talk. I always give you my best recommendations, but then there's second best, third best, fourth best, right? Whatever we can do to help, that's what we're trying to do. But symptoms associated with seasonal allergies can occur during various seasons. Of course, we have spring and it's high trees, right? Then we have summer and the grasses are high, and then here comes fall and here's the weed, the ragweed, those types of things, and then molds, fall through winter. But common seasonal symptoms are runny nose, itchy eyes, sneezing, congestion, headaches, fatigue, coughing. But people don't always think about fatigue, but it is a huge factor with sensitivities. But 19.2 million adults were diagnosed with hay fever within the past 12 months. That's insane. Really. 5.2 million children were diagnosed with hay fever within the past 12 months. And it's just going to get worse because global warming, it increases the increase in the temperature and the earlier winters right? And the Indian summers, the later summers and into October, sometimes even here on the East Coast, contribute to those things. And it's just is what it is, but we're reacting longer and more severe. But prior to AAT, a patient said, I suffered hay fever constantly throughout the day and night. I tried everything for relief, but never found a permanent fix. I was skeptical at first. So was I, just believe me. But after 2 visits with AAT, I went from having hay fever on average 4 hours a day to not having hay fever at all. The results speak for themselves. I now recommend AAT to everyone I know that has allergy problems. Thanks, Cameron. But individuals may exhibit reactions to substances present in common environments such as workplaces, residences, and outdoor settings. I mean, I had this forever, and let alone someone's perfume, right? But pollen, dust, pet dander, mold, huge in HVAC systems. Cockroaches, chemicals in pollution, even in the schools. It's just true. It's just not just, workplaces, but these kids really do suffer in these schools. As many as 10% of Americans are sensitive to dust mites. You can't avoid dust mites, they're everywhere. But about 1 in 5 people in the US have been diagnosed with environmental allergies. Headaches and migraines. I can't tell you how common it is. People are on, injection medications for years, and just constant medications, right? Those non-steroidal anti-inflammatories, right? Yeah, it's symptom relief, but they have their consequences in the body. It's just the truth. Almost every medication has a side effect. But allergies can contribute to the occurrence of 2 types of headaches, migraine and sinus headaches. Common triggers are foods, mold, pollen, pet dander, fragrances. Tons of issues that we see with this. But here we go. Approximately 45 million of Americans complain of headaches each year. Every year, more than 8 million Americans visit their doctor for a headache. Another patient testimonial said, I used to get headaches if I drank red wine. After treatment for the red wine, I could drink red wine with no side effects. All I know is now I feel like a different person. Yes, Barbara. Woohoo. Asthma. Allergy-induced asthma is very common. Most common triggers, mold, again, dust mites, pet dander, grass, pollens, fragrance, chemicals, right? These are just things that are triggers. 8% of adults suffer with asthma. 6.5% of children suffer with asthma. It's horrible. It's scary, right? A variety of skin conditions can also arise as a result of allergic reaction. Urticarias, hives, eczema, contact dermatitis, atopic dermatitis. Common allergen triggers are food, nickel, like your jeans, your little button on your jeans, and you get that little mark there. Sometimes in your earrings, right? Different metals as well. But pet dander, fragrance, grass, chemicals in soaps, lotions, all are personal care products, right? In the past 12 months, there have been 9.2 million reported cases of skin allergies in kids. I mean, what's your solution? People are just using corticosteroids like I did forever. And then, they can lead to all kinds of issues. I mean, people know the steroid issues. It's not something you want as your main treatment. It has big consequences. But hives affects approximately 20% of the population at some point in their lives. So it's frustrating. Another patient, Anthony. I had eczema for over 7 years. I used to use steroids every few days for years. Me too. But the eczema would keep coming back after a few treatments. I don't have any eczema symptoms and don't need to use any medications. I also had chronic cough for over 10 years. My doctors thought it was reflux. However, only after a few treatments, my cough is almost completely gone. So, yay. And we'll finish up here too, but basically chemical sensitivities, they can cause sensitivities, carpeting, plastics, perfumes, paint, cigarette smoke, personal care products, just to name a few. And then 25% of Americans have chemical sensitivities. They've increased by more than 200% in the past 10 years. These sensitivities for food allergies can contribute to a wide range of symptoms. Again, digestive, respiratory, skin, of course, top ones, big ones, nuts, soy, wheat, sugar, dairy, food components, things that are common to foods like latex. That was me. Latex is commonly found in food, naturally occurring, and I was reactive to almost every single food that had latex. I had no idea. But about 32 million people in the U.S. have food allergies. That is 10.8% of adults and 7.6% of kids. wasn't able to eat my favorite foods. I'd get uncomfortable digestive issues. Would have to suffer from now until I heard about this therapy from a friend. I figured it couldn't hurt to try since I tried everything else. That was me. That's exactly what I said too. After just a few treatments, I'm ready eating some of my favorite foods without any symptoms. Yay! Truly, it's night and day. I mean, there's nothing bad that's going to happen. You just, if it didn't work, there's something else that's going on. AAT can help resolve the many symptoms and conditions associated with allergies and sensitivities. AAT treatments are performed without pain, avoidance, or needles and offer rapid long-term results. And then again, stop avoiding substances that are causing symptoms. Start living the life you want to live, right? Expand from a restriction. Enjoy the things you have been missing. Get outside again. It makes me so sad, especially after COVID. It's like, and people had allergies and they still stayed inside. I'm like, oh, but eat your favorite foods. Like, eat the rainbow. It's like, eat, pray, love. Eat, play with your pets, right? Be able to play outside, roll in the grass, like go have fun, especially the kids. My goodness. Stop avoiding and start enjoying, right? That's the big key. But if you're interested in moving past your allergies or sensitivities, contact our office, make an appointment today and give AAT a try. You'll be happy you did. Really, truly, again, I forgot to put my stuff there, but basically it's Allergy Breakthrough Center. It's 908-335-5673. It's allergybreakthroughcenter.com. You can literally just call me or go online and book an appointment with me. Allergybreakthroughcenter.com is a contact us page. You can get in right there and then we can have a chat. It's not a sales call. It's just a chance for us to really actually talk, look at what's going on and address those things. And that's what I'm happy to do for you. Thank you so much for spending the time with me today. Have a great day. Happy New Year. Again, I forgot to put my stuff there, but basically it's Allergy Breakthrough Center. It's 908-335-5673. It's allergybreakthroughcenter.com. You can literally just call me or go online and book an appointment with me. Allergybreakthroughcenter.com is a contact us page. You can get in right there and then we can have a chat. It's not a sales call. It's just a chance for us to really actually talk, look at what's going on and address those things. And that's what I'm happy to do for you. Thank you so much for spending the time with me today. Have a great day. Happy New Year. Again, I forgot to put my stuff there, but basically it's Allergy Breakthrough Center. It's 908-335-5673. It's allergybreakthroughcenter.com. You can literally just call me or go online and book an appointment with me. Allergybreakthroughcenter.com is a contact us page. You can get in right there and then we can have a chat. It's not a sales call. It's just a chance for us to really actually talk, look at what's going on and address those things. And that's what I'm happy to do for you. Thank you so much for spending the time with me today. Have a great day. Happy New Year. Again, I forgot to put my stuff there, but basically it's Allergy Breakthrough Center. It's 908-335-5673. It's allergybreakthroughcenter.com. You can literally just call me or go online and book an appointment with me. Allergybreakthroughcenter.com is a contact us page. You can get in right there and then we can have a chat. It's not a sales call. It's just a chance for us to really actually talk, look at what's going on and address those things. And that's what I'm happy to do for you. Thank you so much for spending the time with me today. Have a great day. Happy New Year. Again, I forgot to put my stuff there, but basically it's Allergy Breakthrough Center. It's 908-335-5673. It's allergybreakthroughcenter.com. You can literally just call me or go online and book an appointment with me. Allergybreakthroughcenter.com is a contact us page. You can get in right there and then we can have a chat. It's not a sales call. It's just a chance for us to really actually talk, look at what's going on and address those things. And that's what I'm happy to do for you. Thank you so much for spending the time with me today. Have a great day. Happy New Year. Again, I forgot to put my stuff there, but basically it's Allergy Breakthrough Center. It's 908-335-5673. It's allergybreakthroughcenter.com. You can literally just call me or go online and book an appointment with me. Allergybreakthroughcenter.com is a contact us page. You can get in right there and then we can have a chat. It's not a sales call. It's just a chance for us to really actually talk, look at what's going on and address those things. And that's what I'm happy to do for you. Thank you so much for spending the time with me today. Have a great day. Happy New Year. Again, I forgot to put my stuff there, but basically it's Allergy Breakthrough Center. It's 908-335-5673. It's allergybreakthroughcenter.com. You can literally just call me or go online and book an appointment with me. Allergybreakthroughcenter.com is a contact us page. You can get in right there and then we can have a chat. It's not a sales call. It's just a chance for us to really actually talk, look at what's going on and address those things. And that's what I'm happy to do for you. Thank you so much for spending the time with me today. Have a great day. Happy New Year. Again, I forgot to put my stuff there, but basically it's Allergy Breakthrough Center. It's 908-335-5673. It's allergybreakthroughcenter.com. You can literally just call me or go online and book an appointment with me. Allergybreakthroughcenter.com is a contact us page. You can get in right there and then we can have a chat. It's not a sales call. It's just a chance for us to really actually talk, look at what's going on and address those things. And that's what I'm happy to do for you. Thank you so much for spending the time with me today. Have a great day. Happy New Year. Again, I forgot to put my stuff there, but basically it's Allergy Breakthrough Center. It's 908-335-5673. It's allergybreakthroughcenter.com. You can literally just call me or go online and book an appointment with me. Allergybreakthroughcenter.com is a contact us page. You can get in right there and then we can have a chat. It's not a sales call. It's just a chance for us to really actually talk, look at what's going on and address those things. And that's what I'm happy to do for you. Thank you so much for spending the time with me today. Have a great day. Happy New Year.